growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, Dr. Steve Rasner back here with The Lionhearted. You know I always start by telling you can reach me, and I want you to reach out to me, please, at my personal email, which is drrasner, drrasner at AOL.com. And let me know what you want me to talk about. And as long as I feel that that resonates with a lot of your colleagues, and that's the topic I'll get to next. So, I want you to begin this week with this thought. Do you ever go to the gym and look around and see somebody maximally ripped or in shape and say to yourself, damn, I like to be that? And you realize that there's a lot that goes with being that, correct? Or even an athlete, a professional athlete, and just wondering, what's the difference? I mean, how can they jump so high? How can they run so fast? All those things. And the truth is I could train 10 hours a day the rest of my life or even earlier in life, and I would never probably be able to dunk or jump high enough to dunk, because some things you just can't do. But tuning into these podcasts, wondering how you could replicate the blueprint of extraordinary success that I've experienced, you absolutely can do. It's absolutely doable. And that's what I meant in the last couple podcasts when I said to you, have you looked in the mirror? Are you all in? And you got to ask yourself that, because the only thing that's separating you in the profession that we both chose, those of you that are out there that may not be feeling it, meaning you're not feeling the success that you hear others are having, I'm here to tell you that an average guy, me, was able just to outwork everybody else, stick to and it's hard. Because when I say outwork, I mean a lot of things. I mean attention to detail on how my practice is running and what I like and don't like, and taking notes on that. And then dealing with that when I wasn't in the office, and changing the protocols on how I do and run my business because I paid attention. I trained just like the athlete trained. That was my training. Or realizing that I'm at the end of the road, maybe, with a certain staff member that I've really tried to alter their work ethic or what they stood for relevant to my office and what I believe in. And, dealing with that, not just letting that go on for weeks and weeks and months and years, which we've all done, right? I've done it, where we have that staff member that just doesn't fit into your vision of what you've been trying to create. It's hard, man. That's one of the hardest things, by the way, of setting up in a rural area that nobody talks about. Pete Dawson, God bless his soul, he just passed, used to say and believe that build it and they will come. Meaning, if you had amazing clinical skill, it didn't matter where you were located, and you would eventually find success. And I think that's partly true, not fully true. Because the one thing that makes it harder when you're located where I am, which is in a very rural area, it's in an area that's been decimated by economic challenges ever since I've been there. I'm from that area. I grew up in this area. I don't live there now. I haven't lived there since I've been a dentist, but I practice there. And the problem when you're in such an area is getting the best team members together to help you create this organization you keep hearing me allude to. So let me not get off track too much. What I'm saying to you today in this podcast is you can have the ultimate dental practice. It just requires a lot of diligence, crossing T's, dotting I's, going back over things that you thought everybody got already, but it was evident to you this week, like it was to me, that's after 39 years, by the way, that they don't get it. And what are you going to do about it? And it is easy to forget about it and close the door on Thursday afternoon or Friday and go home and turn the page on Monday. And the problem with that is that turns into often months and years later, as I alluded to a few minutes ago, and you're still in the same practice. So man, listen to me. You can really have. I was not, you guys know my story. I was not in the top fifth of my class. I was in the bottom fifth. And that wasn't because I fooled around and didn't get it in dental school. It's because I was surrounded by a lot of guys that were really good with the early academics that you and I were exposed to. All the histologies, all the physiologies that I had never had in undergrad school because I was a psych major. And I got my doors blown out and held on by a thread. I did. And I just could never make up enough ground in the last 2 years to be ranked anywhere. So what am I telling you that for? Because I couldn't get a post-grad residency. Nobody wanted me. I don't blame them. If you're just looking at raw grades, I wouldn't probably have taken me either. And so I had to reinvent myself academically, clinically, with just a bevy of courses. And you got to do that, by the way, if you're ranked number 1 in dental school. Because as we both know, there's not enough time in 4 years to become this great clinician. So that's what I did. And that was just a little part of it. How do you run your office? What are your protocols for managing difficult patients? And, what insurances are you going to take or not take? So this is where this all comes from. This is why I do this with you. Trust me, I think about why am I doing this? I've told you before, I don't hide anything from you. I've made it clear that I hope you guys, this will spin off more presentations for me, or I'll get to meet many of you because you'll come to New Jersey and perform live surgeries with me, which you're allowed to do, which we've talked about many, many times. By the way, go to the Rasner Institute, RASNER Institute.com, and you'll see where I'm speaking. And you'll also see when my courses are in the next 2 years. By the way, it is working. My next 2 courses, which are October of this fall to October 2019, and my first course of 2020, they're sold out already. I mean, I'm not playing. I'm not just telling you that so you'll call and try to get in. They're really sold out. But I have at least 2 more I'm going to give in 2020. So if you're interested in that stuff, the things that, look, I believe this. I believe there's certain skills that you just must participate in with hands-on to be able to take that back to your office. You simply cannot watch enough, 99% of us cannot watch enough YouTube video on how to atraumatically extract a tooth, or certainly how to place an implant, and go back to making that a normal service that you provide at a high level in your office. There's a step, and many, many of you are in programs, which I absolutely commend you for right now. Maxi programs all over the United States, and many other programs where, you get out and you still haven't done hands-on live surgeries. Well, you can do that in my office. I have an amazing arrangement with the New Jersey State Board of Dentistry. And trust me, it wasn't easy to get. Where you can come in as long as you have a license in your state and active malpractice insurance. And I actually, at this stage, have no way monetize this program, meaning I'm limiting it. I limit it to 8 doctors as we speak. I've thought about expanding it and bringing in other guys to help teach with me. But as we speak today, I don't have that. And I'll never make, listen, when I did the Misch Institute in the 1990s with the famous icon Dr. Carl Misch, there was 90 guys there from all over the world. And, even, and most of us did not get to do live surgeries because there was a limit to how many people could bring patients, etc. But that was the moment of truth for me. I would never be the surgeon I am today if I had never had that experience. And I believe you need that if you're into what I'm advocating. And listen, man, you need to know that everything I tell you is from absolutely two places. My heart, because I love doing this. I love when I get an email. I mean, you can't make everybody happy, but I get a lot of emails from a lot of dentists, young and old, that tell me that whatever I'm saying is resonating exactly with them, and they want to have a practice like I describe, and it is doable. I just don't know how many times to tell you that. It'd be one thing if I was the number one ranked student in my class and everything always came easy to me, or maybe it wouldn't be as impressive if I opened up in Philadelphia and I had this amazing practice. I am in Cumberland County, New Jersey, which has been very good to the speaker here. And so I don't in any way, in no way am I disrespecting the people of Cumberland County. That's where I'm from. That community has served me well for 39 years, but it wouldn't be most people, it wouldn't be your first choice of residence based on the economic parameters. And it makes it very challenging to have a fee-for-service practice in that community, and a lot of other challenges as well. And yet I've done that. I've done it at a significant level year after year. So I'm getting off the track, which I know I'm famous for. And I want to bring you back on this podcast and the next podcast to a couple concepts that I want to just kind of brief you on. I went back because you have a limited amount of time. I'm sure I'm not the only guy you listen to. And I want it to resonate with you. I want it to be, I hope he talks about that again. So I actually went back and I looked at the topics I've discussed that are the most downloaded. And they are absolutely, when I talk about reaching maximum productivity, when I talk about the anatomy of a killer week, which is kind of the same thing over the course of a week. Every case acceptance podcast I've done is heavily downloaded, as it should be. Because I made no bones about it, that is the number one topic that I find the hardest to communicate and get a large amount of my listeners or just my colleagues to actually understand how to do that. Think about it. It is amazing to take a person, not only where I'm from, but any place in the United States that you haven't met before, and recommend to that patient, in many, many cases, a treatment plan that costs them an extraordinary amount of money. Not because you're trying to get in their pocketbook. I get it. Because you have a comprehensive, which you should, care approach to all patients that walk in your office. That you refuse to be a one-tooth, myopic dentist driven by insurance, and that's going to determine your treatment plans. Are you kidding me? Is that what they do with us when we have a problem and we need something with our heart or our kidneys or our livers or everything that they do in medicine? Is that what they do? That they just determine what our insurance covers and based our treatment plan around that? Come on, guys. That's not good enough for you and me. So, this is a big thing. It's a big deal. And you better spend significant time on it if you don't. Look, you got a lot of choices. And I know I'm taking up all my time kind of rambling here, but I'm not rambling over nothing. I'm rambling over, nice word. I'm rambling over, I know the concepts that hold you back. I do. And one of those concepts is that a lot of you are afraid to talk to patients or run your office from that perspective, a comprehensive care approach, because you think that they'll run away from you or they won't want your care. And that will be true for some patients. But how true that is completely depends on an abundant number of things, from the very first phone call to the moment they walk in your office, to the moment you walk in the room. There's a mindset to who you brought to that initial visit. Are you kidding me? Do you even ask for the significant other to come to that visit? How could you not in 2019 if they've indicated that they have significant needs? How could you? Who makes decisions over $5,000, $10,000? And you don't know that it's going to be that, but you don't know that it's not going to be that. So who makes those decisions without a significant other? I don't know too many people that do. That is why that one little concept of bringing the significant other to that initial visit, if that patient in any form or way on the phone indicated need. Oh, I haven't been to the dentist in 4 years. Oh, my mouth is a mess. I'm really afraid. I haven't been in a while. Anything like that, we automatically trigger and go into, well, let me tell you what we're going to recommend. Now, let me just say to you guys something. Write to me or Michelle, Michele, at pearlsmiles.com, because she will enjoy writing back to you. I think she has a few blogs on how to say that, on how to get, or just write to me on what is it I'm talking about? What is the dialogue that you can easily communicate over a telephone to get a significant other? I know a lot of you, to come to that initial visit, I know a lot of you are listening to me right this minute, but do you really get me? Do you really embrace and try to make these kind of changes? And I always give you this rule that allows you to do that, and that's called the 120-day rule, which means try what I tell you for, not for a week or two, try it for 3 months. I mean, what did I just say to cost you any money? What's the risk? To ask them to train your front desk person. So I have one person out of 18 in my office. 1 out of 18. And everybody's been with me for a number of years, but there's only one I really trust to handle the flavor of that new patient phone call, because I know she gets it. You know, I'm going to give you an example. I didn't intend to do this. I got way off track, and that's the way it is. I have 2 offices. So if my associate's listening this week, she's going to get mad at me. But I got really ticked off this week on how they handled a new patient. So I'm going to tell you what not to do. So they had a new patient in the office, and I don't know the details of the treatment plan, but I can tell you it was pretty significant. It was north of $7,000 or $8,000. And this particular patient also, it was a mother, was taking care of her daughter's treatment plan, which was of an equal or even greater amount. So this is a big player in the normal week of most of us. So, you know, 8 plus 8, or it might even be more than that, $16,000 treatment plan that, you know, the patient accepted and paid for. So here's what happened that made me furious. What happened was that my associate, the patient needed 1 extraction, and my associate sent the patient out to an oral surgeon. Now that's fine, except that I teach. I'm in a different office. Keep this perspective in mind. I teach other dentists how to take teeth out. So why would you do that? Are you kidding? You want to know what drives me crazy? The guy doing these podcasts every week with you? Can you imagine? I'm doing these podcasts with you, and yet I'm telling you in my own organizational network, somebody just accepted a treatment plan, and part of that treatment plan was to extract a tooth, and they sent it out of the organization. Number 2, they needed a physical medical clearance. So they told the patient to get a physical medical clearance. Are you kidding me? Listen, if you do nothing else from this one podcast, write to me. I have a university level physical medical clearance form that Beth will send you. That is complete. I did it myself. I modified other very good ones I found from really good institutions like the Mish Institute and things like this. I modified it and made it even better. And you can fax that to the medical office, and it covers everything from the oral sedation we give them to the anesthetic you're going to use to what exactly you're going to do. And I mean, it's very, very thorough. And it covers all kinds of things that you'll be doing, whether it's root canal, multiple extractions, whatever it is. So ask me for that form and have that as part. See, I assemble. On my laptop, I have a folder with all the great forms I acquire over the years. And I do this with everything I do, what relevant to my practice. I'm always downloading the best articles. I may not read the article right on the spot, but I know I want to get back to it. So there's a little folder on my window that says articles you must save and read. You know, the other folder is forms excellent for the practice or something like that. And this one's one of them. And those of you, of course, that take my surgery courses would get all this stuff. Anyway, so because it's part of the course. But so the bottom line is, I'm telling you, is even in my world, things don't always go under the protocols that I've laid out and designed. So I have a separate office, think about this, that had an accepted treatment plan, sent the patient out for the first visit. By the way, if this was a ASA 3 or 4 type of patient medically, absolutely I would endorse. I did that myself this week, sending them to having the care done in the safest conditions. I'm not a cowboy. You need to know that. I know I come off, in your face kind of guy. Well, that doesn't go with being a cowboy when it comes to clinical care and the health of my patients. I can count on one hand in my 39 years that I've had to call 911 for anything. And I don't think that's a coincidence. I think it's a result of me really screening patients and making sure that the ASA 3s or 4s do in fact go to an arena where it's safer in case something goes wrong, be it a hospital or an oral surgery office. But that wasn't the case here. I have no idea what that was about. And on top of it, if you need a medical clearance, why would you just tell them to get a medical clearance? Are you connected to this patient now or not? You're setting yourself up for the following. You're setting yourself up for buyer's remorse. And let me tell you, man, it's a big deal. What you and I do every day, what I do in the scope of 12 months a year for as many years as I can remember. There used to be a slide in my presentation called Everything Counts. It's true. Everything counts. Even little minutia like I'm describing to you right now. Everything counts. And these patients, especially when the great majority of the profession doesn't follow this protocol of comprehensive care, it makes us stand alone even greater. So it would not be, let's just say it the way it is. It wouldn't be unusual for some patients to think that you're crazy with, what do you mean, $8,000, $10,000 to fix up my mouth? I've been going to a dentist for 30 years and my insurance covers just about everything. You get me now? I mean, the one reason I can talk with conviction when I speak to you like this is because never once in any one of these podcasts, never once when you're not watching me, do I ever do anything for the sake of anything but their optimal health and doing things which I believe are the right things the right way. And sometimes, very often, I go through the whole protocols that I deliver to you, share with you, and the patient can't do it. And sometimes there is a plan B. And I've discussed that in prior podcasts. So this is where I want to leave you. I didn't really get to the nitty gritty, but this is what I'm going to do in the next podcast. Sometimes I got to just talk like this. I told you in many podcasts ago that I want this to be like you and I are having a beer or ice water or iced tea or whatever. And we're kind of shooting a you know what about how to make the practice successful. I mean, what else are you going to do? You know, okay, I tell you what else you can do. Get 10 offices and don't give a crap for the most part about the quality of work that you putting out there under your name, and then flip those to New York, Wall Street, cash out big time money. You can do that. That's not what you're tuning in here for. That's not what I'm about. You know? Invent something else that's got nothing to do with what I'm talking about and make big money that way. Here's what I'm saying to you. You can make a significant living. You're not going to get filthy rich doing what I'm doing, telling you what to do, but it's a good life and you're doing good things. Let me tell you, last thing I want to say to you. The next podcast, by the way, will be reaching back towards how do you get maximum productivity? How do I get the anatomy of a killer week? What is the anatomy of a killer week? And let me finish with this. You know, I want to tell you some phenomena I kind of discovered this week that really made my whole week. You know, ever since I got involved in a lot of CE back in the 80s and 90s, it just became consistent with me that I had to raise fees, it seemed, more than a lot of my colleagues to provide the care that I was trying to provide. If you're going to use high-end dental labs, if you're going to use, products that not every dental office has, and have really extra staff, not understaff, that costs money to do that. And I often thought that patients maybe didn't like me because of that. And I'm sure there are some that don't. But I got to tell you, I've never had more conviction, as if it was the dental gods giving it to me, that this is the right way. So many patients have acknowledged in these last couple of years of practice, and certainly very recently, that patients that left me, that were gone for 3 years, 5 years, in one case 28 years, and a lot of the work that we had done stands and looks amazing and doesn't need to be redone. Not all the time. And they know it. In other words, sometimes you wonder if the patients get what I'm trying to do and trying to give you the message of what I think you should do. And I'm here to tell you that they do. So anyway, thanks for staying tuned in. Next week, I'm going to give you more specifics on how do you get out of where you're at right now. And I mean, you can't do what I'm telling you to do if you're spending 90% of your time trying to produce for insurance companies. So let's figure out how to get you out of that. Thanks for tuning in. I'll see you next week on The Lionhearted.